Hello everyone, my name is Jessica Evans, and today I'm going to be teaching you about chest tubes. I want to thank you for joining me as we discuss this important topic because when you start your nursing practice, you will see chest tubes in the clinical setting. Therefore, it's important for you to have an understanding of them so the patient can receive the proper therapy that the chest tube offers. I want to teach this topic because every student entering their clinical setting and even newly registered nurses have a lack of understanding regarding chest tubes, what they are, how they work, and how to manage them. Therefore, this module was developed to help you ease your anxiety in the handling of chest tubes when you see them in your clinical setting. Before we get started, I want to remind you of this quote, which I thought was appropriate for today. Inhale, then exhale, and that's how you'll get through it. At the completion of this lesson, you'll be able to discuss lung physiology, describe why a chest tube will be indicated and when it would not be, assess the proper functioning of a chest tube, identify, troubleshoot, and correct air leaks within the chest tube system, and understand the nursing considerations when caring for a patient with a chest tube. The respiratory system is divided into two parts, the upper and lower systems. For this lecture, we will be discussing and focusing on the lower respiratory system, which contains all of the organs and structures located below the larynx, with an emphasis on the pleural space. The composition of the thoracic cavity allows for gas exchange. Each structure of the thoracic cavity has its own special function, but when an injury occurs, the function is altered and must be corrected, otherwise the perfusion is lost. The location of the injury is within the pleura, and the chest tube is inserted within the pleural cavity. The physiology of the respiratory system is driven under negative pressure. This concept is difficult for students to understand because it goes against our natural way of thinking. But let me explain. During respiration, constant atmospheric pressure is exerted against the lungs. For the lungs to expand, more surface area is created by contraction of the diaphragm, thus decreasing the pressure inside the thoracic cavity. This negative pressure becomes less than the atmospheric pressure. During expiration, the reverse happens. The diaphragm contracts. It decreases interthoracic surface area, therefore increasing the pressure that exceeds the atmospheric pressure. A thoracostomy is a minimally invasive procedure where a tube is inserted into the pleural cavity to evacuate air or liquid. This procedure is done at the bedside in an emergency department or in the ICU. Also, patients who are undergoing thoracic surgeries will have one placed to evacuate the air within the thoracic cavity. Because a collapsed lung is considered a medical emergency, there are no absolute contraindications to a chest tube placement. However, there are factors to consider and to be aware of. A patient currently on anticoagulation therapy, conditions affecting a patient's coagulation cascade, and any previous thoracic surgeries must be noted. A chest tube should never be placed in the same spot twice, due to scar tissue formation from previous procedures. When the pressure inside the thoracic cavity remains greater than the atmospheric pressure, a disruption of the functioning of the entire respiratory system results, and a chest tube is indicated. If left untreated, this positive pressure is applied on the heart, knocking out preload, resulting in cardiac arrest. Therefore, the goal of chest tube therapy is to restore negative air pressure within the pleural space and restore perfusion. So let's check your knowledge. A nurse is caring for a client with a chest tube. Based on the knowledge of lung physiology, the nurse knows that a chest tube is inserted for what reason? 1. To restore perfusion and positive pressure inside the pleural cavity. 2. It's inserted inside the lung tissue to maintain oxygenation. 3. To increase patient discomfort. Or 4, to restore perfusion and negative pressure inside the pleural cavity? If you answered number 4, to restore perfusion and negative pressure inside the pleural cavity, you're correct. Answer 1 is incorrect because the lung physiology works under negative pressure, not positive pressure. Answer 2 is incorrect because the chest tube is not inserted into the lung tissue, it's inserted into the pleural space. Answer 3 is incorrect because although the chest tube does cause pain and discomfort, the goal of chest tube therapy is not to purposely cause this to the patient. And answer 4 is correct because based on your knowledge of chest physiology, the goals of chest tube therapy is to restore perfusion and negative pressure inside the pleural cavity. Once the chest tube is placed, it must be connected to a chest drainage unit. The types of drainage units are easily remembered based on their names. Ocean is water and indicates a water seal unit. Oasis is desert, indicating a dry seal unit. Both types of drainage systems have the same components but operate differently. Their function is the same, and these units can drain air and/or fluid out of the pleural cavity in the same manner. The difference between the two lies in the suction control chamber. The suction control chamber is used to regulate suction pressure inside of the pleural cavity and restore negative pressure inside the thoracic cavity. For proper drainage, the unit must remain below the patient's chest. The suction control chamber on each drainage system is noted with the letter A on the unit. The chest tube system can be hooked up to a wall suction to assist in increasing the rate at which fluid or air is evacuated from the pleural space. When additional suction is not used, we say that the drainage unit is quote-unquote water sealed. Water seal allows for gravity to assist in draining air and fluid from the pleural space. The suction control chamber is connected to the water seal and collection chambers. When setting up the water seal system, it must be done under sterile technique. Therefore, sterile water is used to fill the chamber. To assess for suctioning, when looking at the ocean drainage unit, you will notice gentle bubbling from the suction control chamber. For the Oasis suction control, when the orange bellows are expanded, as labeled as E, this is your indication that the suction is present. The water seal labeled as B on the drainage unit is considered the patient safety mechanism of the unit. The water seal chamber is connected to the collection chamber, as discussed later, and allows for air to exit the collection chamber through a narrow channel and bubble out through the bottom of the water seal. Air, therefore, is allowed to leave but cannot re-enter the system. With the patient's spontaneous breathing pattern, you will notice a fluctuation in the water seal chamber, called tidling. This is normal and corresponds to the patient's breathing pattern. During inspiration, the water level rises. During expiration, the water level falls. When the patient is intubated, the rise and fall of the water level is opposite. During inspiration, the water level falls. During expiration, the water level rises. The air leak monitor labeled C on the chest drainage unit ensures that the entire circuit from patient to chest drainage unit is an airtight system for negative pressure to be restored and for the lungs to expand effectively. We'll go into air leaks in a few minutes. Fluid flows from the chest tube into the collection chamber as notated by the letter D on the drainage system. Each system can hold up to 2 liters of fluid before it needs to be changed. So let's check your knowledge again. What part of the chest tube drainage unit acts as a one-way valve that allows air to escape but does not allow air to re-enter the chest drainage unit? 1. The air leak monitor. 2, suction control, 3, the water seal chamber, or 4, the collection chamber? I'll give you a few minutes to answer the question. If you answered number 3, the water seal chamber, you're correct. Answer 1 is incorrect because the air leak monitor alerts the nurse that there is a leak outside of the insertion site. Answer 2 is incorrect because the suction control chamber is used to regulate suction pressure inside of the pleural cavity in order to restore negative pressure inside the thoracic cavity. Answer 4 is incorrect because the collection chamber collects air or fluid from inside the pleural cavity. Therefore, 3 is correct. The water seal chamber is considered the safety mechanism of the chest drainage unit, which acts as a one-way valve that allows air to escape but prevents it from re-entering the chest. When a patient has a chest tube, it's imperative that you, as a nurse, assess the proper functioning of the chest tube and that it is doing what it's supposed to be doing. When performing your assessment, always look at the patient first. In addition to your assessments, a focused respiratory assessment is a requirement. Vital signs are constantly being monitored, but they are a very good indication that something is not right with your patient. Other assessments to collect during the focused respiratory assessment include the patient's respiratory rate, the respiratory status, the respiratory pattern, respiration depth, ease of patient breathing, and the oxygen saturation. Palpate around the insertion site to ensure that you do not feel any subcutaneous emphysema or Rice Krispies popping underneath the skin. Ensure that the dressing isn't clean and dry, and if there is any drainage or soilage, you will want to change it. When you're done checking the patient, part of your focused respiratory assessment is to check the tubes and the chest drainage unit. If you're using the ocean drainage unit, check the suction control every 4 hours because that gentle bubbling inside of the chamber causes evaporation, leading to a decrease in the water level and a decrease in the pressure exerted in the pleural cavity. To fix this, do not increase the suction. Instead, fill the water to the designated water level. Ensure that all connections are tightened and or reinforced. Air leaks within the system indicates an external break in the chest tube's airtight seal, distal to the chest tube insertion site. Air leaks can be easily assessed by looking at the air leak chamber on the unit. Upon further assessment, you can then fix the location of the leak. It's important that this leak is fixed because proper functioning of the chest tube depends upon the airtight system. Often air leaks occur at connection sites, which can be corrected by reinforcing the site by taping it. When assessing for air leaks, always start furthest away from the patient at the chest drainage unit and work your way towards the patient. Then check all the connections. If this does not fix the air leak, then assess the dressing and change it if necessary. Lastly, ensure the eyelets of the distal inserted chest tube are not exposed. If they are, then notify the doctor immediately. When you're assessing the chest tube, handle with care always comes to mind. You want to ensure that you are handling it with as much care as possible because there is great risk of the tubes becoming disconnected or dislodged, putting the patient at risk for respiratory distress. When you are looking at the tubing, ensure that it is patent from the insertion site to the drainage unit. Milking and stripping the tubing can cause a dramatic rise in the negative pressure, risking for lung tissue to enter into the tube, causing damage. Check to ensure that there are no dependent loops and ensure the tubing is not dangling on the ground. When moving or turning the patient, ensure that there's enough slack on the tubing that it does not become dislodged or disconnected. The chest drainage system comes with a clamp, but never clamp the tubing unless the chest drainage unit is being changed out. This is your last knowledge check. So let's check your knowledge. When evaluating the function of the chest tube drainage unit, the nurse recognizes an air leak in the air leak chamber. What is the first action the nurse will take? 1. Check the connections. 2. Change the dressing. 3. Strip or milk the tubing. Or 4. Notify the doctor. I'll give you a few seconds to answer the question. If you answer number 1, check the connections, you're correct. Answer 2 is incorrect because this is not the first action. When assessing the chest tube drainage unit, you assess in a methodical method, moving from the chest tube drainage unit to the patient. Answer 3 is incorrect because milking and stripping is not indicated for air leaks. Answer 4 is incorrect because this is not the first action. If after you completed the assessment and interventions in correcting the air leaks and there is still an air leak, then the doctor must be notified. Answer 1 is correct because this is the first action. Based upon your knowledge of chest tubes, air leaks are an indication that air is entering the system from outside of the chest tube insertion site. For the system to work properly, a chest tube must maintain an airtight seal. If you would like more information on chest tubes, you can check out these references as listed above. And there you have it. You have completed this module on chest tubes. I hope that you can take this lesson into your practice and feel more comfortable when you assess them in the clinical setting. Please save this video and refer to it when you need a refresher. Until we meet again, be well and thank you.